Good evening. Jeffrey, I am a licensed physician in the state.
Right,
good. Well, that's okay. We can talk about that later. Actually, we're not doctors. We're misters. You're only a doctor around here. Come on, you put this up there. We're going to talk about this real fast. I'm a history major, so I want to talk about my part, how government has been there to save problems, fix problems. And we can go back very far in history. Keep going. Will we make history this year? I hope so. Because Kierkegaard said life can only be understood backwards but live forward. And you can go back 4,000 years. Hammurabi, the great emperor in Mesopotamia, said he dealt with how to pay for health care. Keep going. George Washington, the smallpox epidemic that was affecting the Continental Army, he went to the Continental Congress and said, we've got to immunize, vaccinate our troops. The British didn't. One of the reasons we won that war. I think you passed John Adams. You know about John Adams, started service for the Merchant Marines. That became the Public Health Service, the CDC. 20th century healthcare reform, the United States. Let's keep going. Teddy Roosevelt, 1912, it's been 100 years, said we should have a social healthcare system in this country. Because at that point, life expectancy was 50, and TB and pneumonia were killing everybody, and Dr. Alzheimer's just discovered what Alzheimer's disease would become. And the reason that we now have life expectancy of children born today that will reach 100 years is because of government intervention in healthcare. That's what's been happening. In 1929, the Blues were born. $6 a year was the premium, and the Blues were a guaranteed issue community rating, FDR. And the New Deal wanted Social Security, national health care, got Social Security, but what we got was World War II, and an employer-based system we have today, not intended to be. Harry Truman wanted national health reform, and the AMA went to its advertising agency and said, call it socialized medicine. That'll really scare everybody, and we're still calling it socialized medicine. That's dumb. Harry Truman, in his last State of the Union, said, we should have a plan for everybody in America. Move forward. Keep going. The disease my parents worried about was polio, and that's me getting my shot, by the way. That's a true picture. And what we did was, through public health, government-run health, we wiped out that disease. FDR wanted health reform. He unfortunately was assassinated. Lyndon Johnson became the president. He signed Medicaid and Medicare into law. Harry Truman got Medicare Card 1. Go back to, I think I got that one. There he is. Keep going. Just to prove it's bipartisan, Richard Milhouse Nixon proposed a national health system in 1971. It looks like a lot like the Bacchus Plan today. He also signed the HMO Act and also talked in his State of the Union address that we should have national health reform. Keep going. A new system makes heart quality. Next one. Ronald Reagan. He signed the waivers that gave us the Access Program. He also signed the bill that gave us Emergency Medical Treatment and Labor Act, which says you can go to an emergency room, you got to be seen. That's a Republican that signed that. He also signed Medicare Catastrophic. George H.W. Bush signed the Americans with Disabilities Act. Clearly, both sides of the aisle, government has been there to solve problems. Then we had William Jefferson Clinton down in Tiny Rock, Arkansas, said we can solve that problem in 1993-94. Health security for all Americans, never got a vote. What we got instead was the Gingrich Revolution, over 95, changed the Medicaid program, Medicare program. The Congress has given us the HIPAA, the BIPA, the BIBRA, the BIPA, and the SHIP, for those who love politics. And then we got the Medicare Prescription Drug Improvement Modernization Act signed by George W. Bush, and that was in 2003 with Trent Franks signing the last vote. Politics and Healthcare, 2008. It's been a great year for politics. George Bush in his last State of the Union just said we should have a system for all of our citizens. Keep going. So what did the 110th Congress do? What did they do? They fought over children's health care, and the president vetoed that bill 3 times. So we got Hillary care, Juliana care, Obamacare, McCain care, all that in that presidential race. We loved that race. And even John McCain jumped in. He said, if we don't act by 2015, the healthcare system will explode. That was the end of his second term, theoretically. Keep going. It didn't happen that way. So we had the election 2008, and clearly healthcare was right on the top of the agenda, fixing this current system. But in Washington, it's polarized. The Democrats and the Republicans can't seem to get along, though Olympia Snowe did side with Senator Baucus. So we have a chaotic, costly, inefficient, inequitable, and a superb system, a paradox. And politicians, the media, have a hard time. Got lots of issues to deal with, going from medical errors to paying for health care. Keep going. And going into the 21st century, AIDS, aging, abuse, addiction, the system doesn't have to change. It must change because the problems we face are so overwhelming going forward. The boomers are coming. All of you born between 46 and 64, too damn many of you. We can't handle you. Finite resources, infinite demand, and that whole question that Tara raised, is healthcare right? Is healthcare a privilege? The Arizona Town Hall 2 years ago in Prescott dealt with that. Accessibility, affordability, accountability. Wonderful document. You can go on their website. So the question is, when does the United States join the rest of the industrial nation of the world and provide universal health care coverage? And the question is opportunity nowhere or is opportunity now here? I hope that opportunity is now here this year in 2009. So there it is. There's President Obama, Dr. Obama saying we need to confront this crisis. Finish it up. Go, last one. The health policy, keep going. It's complicated, as Tara said. Churchill said you got to do the right thing after first attempting all of the possible alternatives. Dilbert did a little bit, and we're done. We want a just system. Are you feeling confident? I'm feeling confident.